My name is Lindsay Vandiver, and I'll be discussing e-force and pill mill legislation, which is addressing the opioid crisis in Florida. So, an overview of the problem. It looks like right now 6 out of 10 drug overdoses involve an opioid, and 2 million Americans abused or were dependent on opioids in 2014. Florida specifically saw a 22.7% increase in opioid overdose deaths in 2014 through 2015. The specific policy is the Electronic Florida Online Reporting of Controlled Substance Evaluation, which is abbreviated to be e-force, and it is a state-mandated PDMP, which means that prescriptions must be reported by doctors or prescribers within 7 days of administration, with the hope of encouraging safer prescribing habits. E-force specifically can be utilized by law enforcement, pharmacists, or doctors to check in on opioid prescriptions for certain patients, whether they come in contact with law enforcement or our doctor shopping or looking for multiple doctors to prescribe them opioid prescriptions. So the study that I'm going to use has been done by Johns Hopkins University, and it's the effect of Florida's prescription drug monitoring program and pill mill laws on prescribing and use of opioids. And it intends to quantify the effect that Florida's PDMP and pill mill laws have on overall and high-risk opioid prescription and use. So it compares Florida against Georgia with sensitivity analyses. Georgia is a variable because it does not have a state-mandated PDMP. Prescribers are just able to use it as they would like, versus Florida, where it is mandated to occur in 7 days. And the study is trying to ask how the intervention of passing this law impacts volume, MME, which is milligram equivalent per transaction, mean days supply per transaction, and total number of opioid prescriptions dispensed. So the methods, they use the IMS Health LifeLink data for Florida and Georgia from July 2010 through September 2012, and they used a comparative interrupted time series analyses, which means that they just looked at different periods of time throughout their observation period to compare the variables that they were looking at. And they measured total opioid volume, MME per transaction, mean days supply per transaction, and total number of prescriptions dispensed. They were able to find that the PDMP and pill mill laws in Florida were associated with modest decreases in the prescription and use of opioids. From the time series analyses, they were able to find that Georgia and Florida were trending in the same way, but they split off a little bit modestly when Florida implemented this law. And they saw statistically significant declines in volume, about 2.5 kilograms per ml. They saw a significant decrease in MME per transaction, 0.45 milligrams per month. And after 12 months, the policies were associated with a 1.4% decrease in prescription, 2.5% decrease in volume, and a 5.6% decrease in MME per transaction. And volume and MME per transaction were both statistically significant at p is less than 0.05. So it looks like state mandating a PDMP is effective in helping to control some prescribing habits. It looks like, especially for volume, that it had a significant impact on decreasing the amount of volume of prescriptions in the state. And so the goal is that hopefully this can lead to not only safer prescribing habits, but safer usage habits, and help to decrease the number of prescriptions that are on the market and decrease access for people that are doctor shopping or using the prescription avenue to receive opioids. And so the study was effective in accomplishing their original question to quantify the results of this law, and they were able to find that it is statistically significant. And so going forward, this has some implications for other states that haven't state mandated. Thank you.